All right, everybody, if you haven't already done it, if you want to log back into Lotus Live using the same participant code, and then we'll get started once I see Kat's on. And then I'll just wait for Sky, and then we can start.
It should show me on.
Are you on? Are you on?
I am.
Okay. Yep, I see you there. All righty. So, I'll get back over. So, like I said, if you have any questions, you can send them to me in the chat, or you can send them to me at the info@nchv.org, or AADDESSI@nchv.org, and we'll compile those questions, and at the end, we will go through those. We'll save a little bit of time for that, and then any extra ones, we'll be able to get those out and get those answered. So, without further ado, Sky Biasetti was born and raised in Southern California and relocated to the rural area of Prescott in 2008 and has been the operations manager for U.S. Vets Prescott for over 8 years. During that time, she also has been the lead organizer for the annual Northern Arizona Stand Down. So there you go.
Well, thank you. Thanks for having me. Cindy asked me to come present after doing a presentation at the HRVP conference last month, and really wanted me to work on showing or going over some of the challenges that you find serving in a rural area, as well as some of the solutions that may or may not be known. If we switch the slide. The first thing I wanted to kind of go over is a couple really rural versus urban homelessness and how different they are. And next slide. Urban homelessness is often assumed only to be an issue, or homelessness is often assumed to only be an issue in urban areas. In urban areas, homelessness is more geographically concentrated, and you see a higher set of numbers and groupings in the urban areas. Therefore, it's very visible to anybody walking down the street in an area where homeless congregate. Due to this, there are typically more supportive services available in those urban areas. Next slide. Rural homelessness. Although rural homelessness populations may experience similar barriers to those that are located in urban settings, the barriers increase for those that are homeless in rural locations. Rural areas typically have less shelters and supportive services available, and additionally, locating the homeless veterans in rural areas and linking them to services regularly proves difficult. Next slide. Point in time count. Problems in locating, defining, and regularly serving the rural homeless population have made calculating the homeless population with certainty essentially impossible, with the estimates primarily relying on counts of persons using services that are often inaccessible to those in rural areas. Many of us that are part of HUD funding are required to do the point-in-time count. In rural areas, that can prove a lot more difficult because, in general, the homeless in our areas are hiding from forestry or from people that may ask them to leave. We regularly in our outreach hear of things, different names they've given locations that are very well known to the homeless individuals, but it doesn't give you the specific location so that, therefore, they feel safe in their environment. An example would be somewhere called Hobo Hill. We may know what Hobo Hill is, but we may not know that location to be able to reach out and do a point-in-time count or do a survey or provide outreach services without really building the trust with those veterans. Next slide. Other reasons it's difficult to obtain accurate counts is rural homelessness are more likely to live in places we do not see, such as campgrounds, abandoned buildings, cars, in the woods, and other places not meant for human habitation. Many families and individuals in rural areas live doubled up or in substandard housing, which may not meet HUD's definition of homelessness, although they're truly individuals that don't have a home. The definition of literally homeless doesn't always fit well with the reality of those that are in rural settings. Low counts, and due to those things I was mentioning, those low counts may exclude many rural communities from being eligible for federal dollars to provide the needed housing and services and support because we're not able to show the numbers of what truly is there. Next slide. We're going to go over some specific rural challenges that we've experienced here in Prescott, and I'm assuming many rural areas encounter the same, if not very similar, challenges. The primary challenges on the next slide are access to services, affordable housing, lack of employment options, low wages or livable wages, and transportation. On the next slides, we'll go over each one. The first one will be access to services. Rural areas tend to lack the infrastructure to provide fast, comprehensive services to individuals and families experiencing homelessness. A lot of times there's less agencies to provide the services and therefore less agencies to be able to go out and compete for grants that could potentially bring those services in to those rural communities. A lot of times you see a lot of our NOFAs and different funding availability are really targeted to metropolitan areas where the numbers of homeless are seen and easily identified. Lately, we've definitely been seeing more in rural areas, and finding ways to be able to compete for those funding sources and really expand the services is really a key to ending homeless in rural areas. The next slide. Affordable housing. This is a pretty much constant topic at every meeting I attend in our rural area. Affordable housing remains the most significant housing challenge in rural America. Additionally, access to housing programs are limited in most rural areas. Because the services we have are small, you have less beds even though there may be more homeless or less supportive of a specific supportive service or less dollars than what is really needed for the different communities. Next slide. The next challenge is lack of employment options. It's challenging for local businesses to turn a profit in rural areas. Therefore, it turns to less opportunities for jobs. Jobs available usually offer low wages that barely hit the minimum wages, and they can't meet the needs, the financial needs for individuals in order to maintain housing. One thing I like to look at, minimum wage is often defined as obviously what the lowest wage an employer can pay. However, that is not necessarily the livable wage somebody needs in order to be able to maintain housing. Next slide. Another very prominent challenge is transportation. In rural areas, there's very rarely any type of mass transit. Individuals are forced to find their own transportation, such as walking, riding a bike, relying on a friend or family member or even a coworker to meet their transportation needs. Expanding on that, in a lot of rural areas, you know, if you have weather, that means you can't really ride a bike or walk, depending on the weather. If you have a family member that maybe takes you but gets sick, then you don't have a ride to work. The transportation issues really can push towards an individual losing employment because they can't find a way to get there in those rural areas. The next slide. We're actually going to start talking about solutions that we've found. I'm sure there's plenty more, but hopefully highlighting some that maybe some of you can use to benefit your programs in really working towards solving homelessness in rural areas. In the next slide, the solutions that we're going to overview are knowing your area and its challenges, capacity building, collaborations, and coordinated assessments. The first one is knowing your area. The phrase knowledge is power really plays prominent when you're providing services in rural areas. You need to know what services are around and what barriers are most prominent to be able to target those barriers in order to help an individual break the barriers to homelessness or to housing. Knowing your area, know what type know what you're up against. Know your community is key component in battling homelessness. Identifying what services are available in your area and determine the services that are needed. One thing we have used is creating a local resource manual, having one entity that really heads that and try to put in writing all the different housing, food services, transportation services, a one-stop guide so that when you have new individuals coming into the area or maybe have not used services in that area, it's really a key to being able to hooking them up to the right areas and the right services. Contacting providers and working together to best serve the homeless population. Resources are sparse, don't duplicate. Although, you may provide housing and you may have another entity that provides housing, really defining what each entity does, they can work together to make sure the right person is placed into the right program. And we'll talk about that a little more in a minute when we get to coordinated assessment. In the next slide, capacity building. We're going to expand on this a little bit. Service provider budgets are always tight. Nonprofits typically run with a very low budget and a very heavy workload for their employees to make sure we're giving the services that these individuals need. But there are ways to build the capacity that don't necessarily break the bank or your budget. A couple programs that we have worked with is AmeriCorps Vista, the VA Work Study Programs, Volunteer Drive, and advisory boards. In the next couple slides, we'll go over each one a little more in depth. The AmeriCorps Vista program, they make a year-long full-time commitment to serve on a specific project at a nonprofit organization or public agency. They focus their efforts to build the organizational, administrative, and financial capacity of organizations that fight illiteracy, improve health services, foster economic growth, economic development, and otherwise assist low-income communities. I've also provided a web address for more information on that specific program, but what we've used it for is Prescott is a touristy kind of area, and a lot of rural places can be. Because of that, one of our biggest job industries is the restaurant and food services, hospitality services. In order to really try to, gosh, the word I'm looking for is escaping me, but using that knowledge, we created a culinary arts program. So we have a housing facility that we feed our individuals 3 times a day through the kitchen. But in order to prepare them for jobs, we said, okay, well, we're already feeding them food. How can we use this as a tool to get them ready for the next step? And the culinary arts training program that we put together, which we call Culinary U, is a program where we have created a curriculum where participants of the program and eventually outside homeless participants can come in and learn how to cook the right way, learn how to use a cooking skill to better prepare them for the job market that we have in our local area. It's in its very infant stages, but has so far proved to be pretty successful with individuals getting employment in food services and being able to use the resources not only to feed the individuals, but now to teach them with the same dollars and expand. We actually brought on an AmeriCorps member to help build that program. They help with building new programs and capacity in order to better the health services and assist in the low-income community that we have. And that was one instance where AmeriCorps has really been a great program. We're using another one to help build our workforce program in order to really target employers to want to hire the veterans that we serve. AmeriCorps Vista, it's much cheaper than having an employee at a full-time forever. These can be capacity building to where they help you get it to where you need to go, and then it's able to be manned with a nominal amount of employees. In the next slide, the VA Work Study Program provides an allowance for eligible veterans accepted into the Work Study Program. Eligible veterans are full-time or three-quarter-time veteran students in a college degree, vocational, or professional program. They can earn while they learn with a VA Work Study allowance. Services performed under VA Work Study Program must be related to VA work. For more information, you can visit the below website. What we've used VA Work Studies is we have them help in our Career Center to help veterans fill out employment applications, help them apply for benefits. The specific guidelines to what they can help are on that website, but this is something that it's basically an intern opportunity for a veteran student. So you're helping not only a veteran student, but you're also helping the program and these veteran participants in breaking down barriers to homelessness. The next slide, volunteer drives. Volunteer drives are a way for service providers to build capacity. Volunteers are looking for a way to serve their community. We have, a lot of times volunteers will come to us and we're not sure what to do with them. What we've really tried to do is identify what projects and assistance that volunteers can help with in, such as like a stand down or specific veteran outreach events, helping a veteran in the Career Center. A lot of the veterans we serve don't necessarily have the computer skills to do the job applications that now seem to be very heavily online. Volunteers can help with that and usually have the patience to help an individual get through an application. Even just to have volunteers come and help cook a meal, sit down and talk with the veterans, give them anything that really promotes community, and volunteers are a good way to help doing that. The next slide, advisory boards. This is something that we have been working with more so in the past year, and they're a great way to build your visibility in the community. Knowing that most of the time employees within nonprofits, they have a lot to do. It's hard to get them out into the community to get out awareness into the community about your programs and what you have to offer. This is where advisory councils can help. They can help with leading and planning fundraising campaigns or seeking donations from area businesses and philanthropists, but really also pushing the visibility of your organization into the community and being able to have those businesses and connections made are the future of your capacity building, both fundraising and programmatically. Moving on to the next solution is collaborations. I am a very strong believer that collaborations is really the key to everything. Different entities have different missions. They have different funding sources that have different rules. Usually once you start collaborating, you'll figure out which rules each have and which placements are best. You may have one program that is specific to a chronically homeless veteran, but you have another one down the street that can take the non-chronic. You guys can work together to make sure that the chronics are getting to the right program versus the non-chronics to really expand what your ability is within a rural area. Why collaborate? There is no one answer or one fix to ending homelessness. Typically, an individual is in need of multiple services to break the cycle of homelessness. There are not many resources in rural areas. Sharing resources is an important step in meeting our goal. Demand for services is up, along with competition for financial resources, making the drive towards efficiency increasingly important. This is even more prominent in rural areas. Duplication of services is viewed as wasteful. If we all work together and we all really learn the services that we have within our communities, it will provide a much better service to the veterans that we serve. The next slide goes into transportation collaboration. Transportation obviously is hard in rural areas. I don't know that there is a perfect answer in any rural area, but some of the things we've looked at is really using our local VA for transportation services when it comes to appointments. Many of our veterans, they have to travel an hour plus to Phoenix in order to get services, and the VA has appointment transportation for those things, and just working with veterans to know the policy of the VA with their transportation in order to expand their options for transportation. Another is a lot of rural areas, although they don't have mass transit, sometimes they have a small business that does like a city bus or taxi service. The funding to be able to afford those can be high sometimes. However, if you work with them, you may be able to see if they would want to sponsor your organization and provide a certain amount as a donation and get a tax write-off if it's available in their area to expand transportation options as well. There are also a lot of little businesses that are for local non-emergency medical transportation. Those are some of the ways we've looked at it. Of course, if you have availability to VA funding and a potential capital grant comes out for van purchases, that can be a really good way to be able to help get your clients into the services and transportation to those services that they need. Now we'll move to the next slide, and we're looking in employment collaborations. This has kind of expanded a lot in the past couple of years that I've seen in our area. You have community colleges usually have a veteran program such as Upward Bound. We don't have VRAP currently, but keeping apprised of any type of education benefits for veterans is also a good skill to maintain for making sure that there's individuals that can expand their education to better their job prospects. That's always a good thing. The VA now has community employment coordinators. I'm not sure if that's all across the country yet, but I know we recently got one. Our employment workforce team works with the VA workforce team in order to try to best place veterans to the different employments. Of course, HVRP, Homeless Veteran Reintegration Programs, are also a key if you have that funding or if you're available to apply for that funding annually. HVRP is a very good resource in trying to hook up veterans to employment and being able to really specify an individual to work with employers and veterans so that they can, one, get employment, but two, maintain the employment, and we can be an advocate for those veterans in their employment goals. Another one that has really become prominent in our area and seems to be getting a lot more attention is the Goodwill Career Centers. If you don't have one, contact Goodwill, see if there's one coming into your area. But the Goodwill Career Centers often provide computer skills training, job interview skills, even mock interviews to be able to prepare a veteran for employment and what employment means. A lot of times some of the veterans we deal with haven't had a stable job in a long time, so relearning some of those skills can be key, and these are some of those tools to help them get there. Continuing with employment collaboration on the next slide is college is for veterans too. Thanks to programs like Upward Bound, the GI Bill, and Pell Grants, veterans can work towards a degree. And a degree, especially in rural areas, can lead to employment at a livable wage. Our community college, I have seen many people, not just veterans, but in general, people I know in the community I've been in for a while, where they go and they get their AA or AB degree through the community college, and then the community college ends up having a need for somebody to teach those specific courses, and they could get into student jobs at the college that often can turn into employment, which could be a good thing to look into in your local community colleges as well. Next slide. Housing collaboration. There's different housing options. Knowing what's in your area and working with individuals who have the different housing options available to place each individual in the right one for the best chance of success is key. A lot of the housing collaboration, or a lot of the housing options are transitional, permanent housing, transition in place, the HUD-VASH program, home-to-home ownership programs, and supportive services for veteran families. Going from literally homeless to homeless prevention in this housing collaboration options. Obviously, supportive service for veteran families is a great resource for homeless prevention and to help individuals that don't have the resources to get into housing, financially assist them into housing where they have the ability to maintain it. Homeless to home ownership programs, and I have ran across one that I'm looking into more but don't have all the details, but in my instance, Flagstaff, Arizona, where this homeless to home ownership program is a program that has financial benefits to where they work with veterans to create a savings plan, and as they save, they pretty much become the fiduciary of that savings. And as they save their money, once they reach their goal, this homeless to home ownership program will actually match their savings and help them search and find a home where they can purchase with the amounts that they save, which is also a good resource. Moving into the next slide, coordinated assessments. Coordinated assessment system is the COC's approach to organizing and providing services to persons experiencing a housing crisis within a specific geographic area. Using a coordinated assessment, providers can adopt a no-door closed policy to ensure whatever door a veteran walks into, they are then assisted through all other doors of the process. The goal with this, and as any of you that have HUD funding will know, coordinated assessments is a mandated process. We are currently using what's called the SPDAT. It is the Service Prioritization Decision Assistance Tool. And in the next slide, it also talks about HMIS, two different ways that agencies can share information about individuals to make sure they get placed into the best service. Moving into the next slide, the SPDAT is an evidence-informed approach to assessing an individual's or family's acuity. The tool across multiple components prioritizes who to serve next and while concurrently identifying the areas in the person's family's life where support is most likely necessary in order to avoid housing instability. Basically, it's a triage, an intake, a placement-focused assessment, housing plan, and ongoing client assessment. This can help you identify whether they need to be in a transitional setting, a permanent setting, or if something such as a financial assistance through SSVF is all they need to be able to maintain and move on with their housing. The next slide. HMIS is a local information technology system used to collect client-level data and data on the provision of housing and services to homeless individuals and families and persons at risk of homelessness. Each continuum of care is responsible for selecting an HMIS software solution that complies with HUD's data collection, management, and reporting standards. We have actually worked with our HMS team and have a MOU between agencies and the disclosure for clients assigned so that we can share information to best assist the veterans we serve. In the final slide, everyone should have a home. Veteran homelessness is a persistent problem in rural America. By working together, identifying needs, and implementing collaborations, we can continue to strive to break the cycle of homelessness. It's up to us as groups to work within what we have to come with the best results, and I applaud all of you for trying to do that. And the final slide is just the references of where I may have borrowed information and pictures. So if you have any questions, they'll be open at one time. And that's all I have, Antonio.
Thank you so much. Okay, so here's those references there again, and we're going to go right along here. This is where Kat is going to start. I have a little bio on her that I'll use really quick. She's a U.S. Army vet and the program manager for Veterans Financial Transition and Reintegration Services with Washington State Department of Veteran Affairs. She manages WDVA's Homeless Veteran Integration Programs, the Veterans Innovations Program, and the Transitioning Warrior Program on Joint Base Lewis McChord, the Veterans Homeless Prevention Program, and the Incarcerated Veterans Reintegration Program. And she holds a bachelor's degree from Eastern Washington University and began her career in Veterans Services with Washington State Employment Security, where she served for 3 years as a disabled veterans outreach specialist. And she was honored as the Washington State DVOP of the Year by the American Legion in 2010. So without further ado, we're going to get on to the next one.
All right. All right. Thanks for having me. And I couldn't agree more with everything that Sky just shared in regards to reaching out to rural veterans. A couple of the areas I'm going to focus on as far as things to consider when serving veterans in rural America is my favorite soapbox is engaging your State Department of Veterans Affairs, and then creating positive partner networks, understanding the transportation challenges, which Sky already went into quite a bit, just understanding and awareness of transportation services that are available in those regions, the limitations and gaps that are there, and potential alternatives that exist. Also, again, as Sky shared, understanding employment challenges. I really want to stress the awareness of labor market trends, occupations that are in demand and in decline. It's really important to know the area you're serving because none of the labor market information in rural areas matches what is going on in urban areas, as you probably all well know. Employer engagement is another really important factor when it comes to serving veterans in rural America. We always want to have those connections with chambers of commerce, the economic development boards, business organizations, and affiliations. We want to make sure that we have all of the contacts that those veterans that we're serving are going to need, because a lot of times in rural America, we only get to touch the veteran once because all of the things that Sky just described. We have veterans that are living off the grid with solar power, and they don't have contact information, no phones, no computer connections, and those kind of things. So sometimes in those rural areas, that one door that they walk through, they're really looking for connections to all things. And wherever we are, if we can communicate together and build partner networks, then there really will be, as the VA says, no wrong door. Okay, next slide. All right, so this is my favorite topic, and I'll tell you why. I was recently blessed to be at the National Coalition of Homeless Veterans Conference, and I was very disheartened to see that only 5 State Department of Veterans Affairs were present at a national level at this conference concerning veteran homelessness. And those 5 states were Washington, Michigan, Minnesota, Virginia, and Arizona. So if you're on the line and you're from another state, I would encourage you to pick up the phone or get on the internet and start to engage your State Department of Veterans Affairs and find out what they're doing in regards to their rural veterans. It's that squeaky wheel syndrome. We want to make sure that all of the State Department of Veterans Affairs are doing their part in this effort. So a couple of things I'll talk about are from the Washington State perspective, some of the things that we are doing in order to support all of the organizations that are out there to serve veterans on the whole, but as well as veterans in rural areas. One of the things we have that's really useful to all of our partners, our SSVF grantees and our community action programs across the state, we have a memorandum of agreement with the Department of Defense for the DIPRIS DD-214 database access. So we have the ability to, within 15 or 20 minutes, access DD-214s. Which is a huge issue as long as we've got that release of information from the veteran, and our partners are really great about providing that. We're able to connect them with the paperwork that's going to qualify them and open the doors to the services that they're eligible for. A lot of times, some areas are dependent solely upon the National Archives, and even if they try and get it expedited, it's at least 10 days. So this is a really fantastic partnership that WDVA has fostered with the Department of Defense, and other State Department of Veterans Affairs could follow suit and have the same types of agreements. So we're able to help our partners and providers out there that are trying, that are our boots on the ground serving the veterans in these rural areas to access that data, that document, so that they can get their veterans en route to all of the benefits and services that they've earned through their service. Another thing that Washington State is doing that's very unique is the Washington State Military Transition Council and the Veterans Employee Resource Group. So in 2013, our governor signed an executive order that established both of these groups. And the Washington State Military Transition Council is all about our transitioning service members. Washington State is fortunate to have multiple military bases within our state, and we know not all states have that, but if your state does have military installations, this is a really valuable council to form, because it's military leaders and government leaders together on the same page planning for military transition. So especially now during this time frame, we've got a lot of downsizing happening, and we're getting inside the gate and being preemptive and proactive to plan out how this transition is going to be facilitated, through the education of the transitioning service members, the education of their chain of command, and those types of things. And we're getting ready to host our second annual Military Transition Summit, which has been highly successful in really educating all of the partners involved in transitioning service members so as to prevent homelessness. And then the Veterans Employee Resource Group is something also very unique to our state that has a lot of support, because it's basically an interagency group. All of the state agencies provide representation in this group, and it's solely focused on the recruitment, retention, recognition, and support of veterans in state employment. And in our state, the state of Washington is one of the largest employers in the state of Washington. And so we would be remiss when we're out there trying to find viable job placements for our veterans to not think about how many different skill sets that are needed and valued from their military service that will easily be transferable to state service of some type. So that's another really great opportunity that other states have to really focus on, putting a fire underneath their public agencies to recruit and retain and support veterans in their employ. Another thing that we have in our state is the DD-214 archive for service members transitioning out. Most states should have this. So whenever a service member says they're going to get out of the military and they claim Washington State as their state of home, not just their home of record, but where they're returning to, we get a copy of that service member's DD-214, and we keep an archive of all those DD-214s. So if that service member says they're going to Washington, we get a copy of it, and then we can release those to partners as long as we get a release of information signed by the veteran. So that's another way to help get that document in their hands sooner. Washington State Department of Veterans Affairs also has financial transition and reintegration programs. I would highly encourage you, no matter what state you're on the line from, to make sure that you're highly engaged with your State Department of Veterans Affairs to find out about the specific benefits, services, and programs that they offer to veterans, because you can use them as an added connection. We have a very unique model in Washington State because as a state agency, we are also own and operate a grant and per diem program for 60 transitional housing beds. And we also have 2 HVRP grants that serve multiple counties in our state. So that's something we're doing. We're constantly going after grant funding and contract funding. And if you don't know what your state is involved in and the types of things that they have as resources to the veterans in your state, I would encourage you to go to your State Department of Veterans Affairs website, educate yourself on the contacts that you can get in touch with to really learn about all of the different programs and services that they offer. We also offer state and federal level advocacy and awareness. We coordinate and collaborate with legislators all the time. So there's a lot of things going on at that level that, most community action programs or nonprofits that are trying to serve veterans, they might not know about some of these things, things that are already in the works that they can maybe lend a hand to or even lend a voice to. We also have in Washington State trained veterans benefit specialists. We handle claims on a daily basis. We act as a complete and total advocate for veterans to the federal VA. We create resource guides and contacts. So the big thing is, if you want a really broad view of all of the things that are out there and available for veterans in your State Department of Veterans Affairs should have a pretty extensive list and a pretty extensive resource guide to connect you with all of those things. Next slide. All right, so creating positive partner networks. I know all of you have partners already. I just created this slide to kind of give you ideas. If there's someone in your community that you're not engaged with already, this might give you an opportunity to think about reaching out to them to expand your network. Obviously, the number one, as I said before, is making sure that you're connected with your State Department of Veterans Affairs to see what they have going on. And I'll really stress everything that I just said about what Washington State Department of Veterans Affairs is doing can be duplicated in other states. So, don't get discouraged if you contact your State Department of Veterans Affairs and they're not doing that. Just make sure you say, well, hey, we heard this is possible. What's the timeline? What would that look like if, this is something we would like to see offered by our State Department of Veterans Affairs? And believe it or not, they will hear those voices, and you can actually facilitate change in your own state. Other positive partners that you want to be able to connect with in your communities. Of course, it's a no-brainer to connect with SSVF, HVRP, and IVTP grantees. They all have, as Sky discussed earlier, different eligibility criteria and different populations that they can help, but sometimes they can be co-enrolled. So leveraging those resources together is very beneficial. American Job Centers, I can't say enough about our partners in the DevOps and the levers. We are so thankful in Washington State about the great partnership that we have with them. And I would highly encourage you to develop those partnerships with the American Job Centers. We call them WorkSource here, but I know that they've gone through several different names. But definitely engage in those veterans specialists at your job centers. They're trained labor market and employment specialists, and they can really bring a lot to those veterans who are trying to seek employment. Community action programs, there's usually almost every rural community has something in place. Workforce development councils, chambers of commerce, you can really connect with a lot of the businesses in that way. Veteran service organizations, stand-downs, Rotary clubs, fraternal organizations, disability support service providers. As you know, many of the veterans that we serve do have a service-connected disability of some sort, and they would also be eligible for disability support services. And transportation providers, again, as Sky said, energy assistance funds or programs, county veterans assistance funds, food banks, clothing closets, Of course, all of your housing options, shelters, HUD, transitional housing providers in the community. Federal VA, of course, they've rolled out their community employment coordinators and the patient advocates at the VAMCs. Even if you're in a rural setting, you know, I can't stress enough how important it is to have a presence at your CBOC, your community-based outpatient clinic, if you have one. Very, very important to make connections, and actually then you can get even more exposure to the veteran population that you do have there. Faith-based organizations, you know, for, you know, decades we've had amazing partnerships with the faith-based organizations that are out there serving veterans, having you know, free meal days or providing different services across the board for the veterans in our communities. And then again, the economic development boards, a lot of our veterans are interested in owning their own business or somehow, you know, being self-sufficient. The economic development boards provide a lot of free education. It's a really great network to have, as well as being able to provide information about your programs there at any of these locations. We just listed marketing and getting your name out there and creating these positive partner networks will really help you expand the net to reach more veterans, and then actually, even with your partnerships, be able to more holistically serve that veteran. You know, have all of the wraparound services together in one place as soon as you bulk up your education and your resource guides and those type of things, so that when that veteran finally, you know, comes out of the hills or comes out of the encampment they're in and they decide they're going to get some help, we should be able to have a wealth of information and programs and services to be able to just surround them with this support and hope for that positive outcome that we're all after. All right. I think that's it.
All righty. Well, we did have some questions. Also here, this next slide, for SAMHSA, they had a webinar series on rural homelessness, and I don't know if you can actually click on that link.
I just tried.
I will. I'll put it in the chat box. So what we have, it connects to our website, and we have a whole page just from that webinar series, and because it's from the Substance Abuse and Mental Health Services Administration, and what they have is a whole bunch of webinars that all you have to do at the bottom of the web page is you log in and register, and then they have a whole bunch of information there, much more stuff than we could fit into a webinar of our size. I'll get that on here right now for everyone. And then, so we did have a couple of questions. So there's that. That's up. So the one was, this was from Stephen. There are no secrets in rural America. Vets facing homelessness often have mental health issues, and getting them to open up enough to get assistance is extremely difficult. There is no anonymity and therefore no outreach and assistance. What are some strategies you both suggest?
The strategies I use, this is Sky with USS. When we have an individual that comes into we do have an outreach team that goes out and interacts with the homeless in the rural areas. To me, the key is really building the trust between you and them, and that you're not there for some preconceived purpose other than to listen and hopefully, if they ask for help, try to give it. Once they have at least interacted with you and you've built that trust, trying to make part of their plan, if for instance, if they came into one of our housing programs or into our workforce program or whatever the case may be, obviously mental health is a barrier, and I can't even believe I didn't even think to list that in there, but it is a major barrier. And working with, for us, we're fortunate enough to have a VA grant for diem grant, and we work with our VA liaison. We have a weekly staffing where we try to address different individuals that may have higher mental health issues and what the best ideas are to address each of those based on that person and that person's needs. And then a lot of it's trial and error and working towards behaviors. They have to be willing to accept that help. You know, you can't force it on them. So, I mean, to me, building that trust with them to where they trust that their best interest is at heart is the key to getting them into those mental health services at some point in time, whether it's in the beginning or midway through a program.
Great, thank you. So I had some other ones that were more like direct questions. I'm just checking, refreshing email just in case, but it seemed like that was it. Did you have anything else you'd like to say, or any other resources? I can't really think of.
Antonio, are you going to publish that presentation anywhere with,
Yeah.
you know, our contact information so we can answer any future questions?
Sure, I can
Sure.
I can write down, I can leave the chat up for a couple minutes. If you
Sure.
want to, you can write down your
Sure, I'll put my email in there.
your email in there. Yeah, that would be perfect. You can just put the chat to all the recipients, and it'll send them that. Oh, perfect.
There we go.
And if they have any questions, they can get a hold of you. I also have just like one direct question, but I can handle that.
You bet. If they have any questions specifically about how to engage their own State Department of Veterans Affairs,
yes.
that's definitely something that we can help with. I know that our director here regularly visits with directors of State Department of Veterans Affairs across the nation, and we would love to be an advocate for them for any of these things that we've got going on that they would like to see in their own state.
Great. That's awesome. And there's Sky's number, too, as well up there. Well, this was... some people aren't seeing... if you look on the question and answers group, you might be able to see the emails more clearly, if you can.
Sorry, that's the only group we can post to.
Yeah.
Okay.
Okay. Oh, no, there were other people asking. So, okay. So thank you, everybody, and thank you, Sky, and thank you, Kat. And their information's up there. I'll leave this up for a little bit so people can write that down. And thank you so much for listening. All right. Enjoy your day.
Thanks, Antonio. Have a great day.
Yes, thank you.
Thanks, Sky. That was amazing.
Oh, you too, my dear. Thank you.
You bet. I like I told Cindy, I love this mission. I'm always eager to help with
I could not agree more.
All right. You have a good rest of your day.
And you too.
Bye-bye.